The gag reflex is actually a response we give to swallowing foreign objects, triggered by the stimulation of organs like the oral cavity and the tongue. In some people, it can be much more pronounced. Under normal circumstances, our gag reflex is very minimal. These can be caused by many different factors. Anatomical factors, previous stresses the patient has experienced, past traumas, breathing difficulties, nasal congestion. These are the factors that play a bigger role. So, how can this be brought under control? In other words, it's almost always psychological in origin. It stems from anxiety and stress, because the patient has always experienced this before. When they come in for later procedures, they're much more stressed out due to the fear of going through the same thing again, and the gag reflex is at its peak. But establishing a trusting communication with the patient or having a conversation to help them relax, then letting them listen to music they like. These can help bring it under control. If it's more severe, sedation or general anesthesia options can be considered. But even before getting to that point, local anesthesia applied inside the mouth already prevents this to a great extent. And as I mentioned, it can also be managed somewhat through building trust. Apart from that, instead of taking impressions with a tray, patients can be made much more comfortable using digital impression methods.